Hi guys, welcome to Health Chats with Marion, where we discuss all things sexual and reproductive health. I'm your girl, Marion McIntyre. Thank you so much for taking the time out to watch this video. So today we'll be looking at 10 things you need to ask before selecting a contraceptive method. But firstly, before we dive into that, what exactly is a contraceptive method? Now, they come under different names. You may hear contraceptives, you may hear family planning methods, you may hear birth control. They're all one and the same. It just depends on where you are. So, a contraceptive is a device or a method that you use to prevent a pregnancy when you don't want to have a baby. And there are various reasons that people use contraception. In fact, it's one of the greatest inventions for humankind. And myself, as a woman, I'm grateful to whoever came up with these methods. Absolutely grateful. So let's ask the questions now. Question number 1. Do you want children? Or if you're currently building your family, how far do you want to space these pregnancies? Now, this question is critical because it does a lot when it comes on to what method you'll select. Contraceptives can be split into two main groups. So you have the short to medium term methods, and then you have the longer term methods. Short-term methods include your condoms, your oral contraceptive pills. It includes your injections. So, for example, Depo-Provera, which you may be familiar with, or Mygesty. Mygesty is actually going to be taking over from Depo in Jamaica. So you'll be hearing that name a lot more if you go to a clinic or a doctor to get an injection. Then you have your longer-term methods. For example, the copper T or Mirena. These are devices that are inserted into the uterus, a T-shaped device, very tiny, that gives you long-term protection, up to 12 years, for example, if you use a copper T. And then you also have the implant. Now, the implant is a very, very, very effective method. And I hope that we do, I'll definitely be talking about this a lot more in sessions to come. But that method, you pop it in and it gives you protection up to 5 years. We have the Jadel, but I think over the next few weeks, we'll be seeing a lot more of the level plant in Jamaica. But they're both the same thing, offering the same kind of protection. I think the level plant gives you protection for 3 years and the Jadel gives you 5, but they work in pretty much the same way. All right, so that's question number 1. Question number 2. Do you have any health conditions that you think could prevent you from selecting a contraceptive method? Now, your doctor will definitely ask this question when you go in to discuss this with him. But just to give you a little bit of info, there are some conditions that are, they're no-no when it comes on to hormonal methods. So, for example, if you have severe migraines, if you have a history of breast cancer, if you have fibroids, if you have high blood pressure, if you smoke, these are some of the things that can, be critical when deciding on a contraceptive method. Thirdly, how often do you have sex? It's important because think about it now. If you don't have sex very often, what is the point of investing in a very long-term method for up to 10 years? If you're only having sex, once every blue moon. So that's a critical question to ask yourself. If you are having sex very often, if you're in a stable relationship, a long-term relationship, then you definitely need long-term protection. But if you are just, having sex casually and it's not very frequent, you can pretty much get by using the condom. Next question number 4. How many sexual partners do you have? Why would I ask that? Important question though, because if you have more than one sexual partner, you may have to consider ensuring that whatever method you select, a condom is in the mix. Now, I know persons may say, but a condom should always be present. But we know that there are some situations, some persons who opt not to use condoms. And that's perfectly fine. It's an informed choice that you have to make. However, if you have several partners, you need to ensure that you're using a condom, because the condom is the only contraceptive method that protects you from not only pregnancy, but also sexually transmitted infections. And that's very important. However, the beautiful thing about the condom is that it can be used in conjunction with other contraceptive methods. So whether you're on the pill, or whether you're taking the injection, or you're having the implant, or you have in the copper T, that's fine. You can use the condom with it, and it will give you that protection from STIs. That's what we call dual use. All right, next question, question number 5. This is relating to the contraceptive method now. So if you're looking at the various methods and you're trying to figure out which one to select, you have to look at how effective is the contraceptive. Effectiveness varies based on the method that you're looking at, and it can vary from anywhere from 95% upwards if they're used properly. If they're not used properly, the effectiveness goes down and continues to go down. But for example, the condom is 95%, the male condom is 95% effective when used properly. The Jadel, which I mentioned earlier, is extremely effective. It's over 99% effective. So this is something that you may want to, spend some time to look at the effectiveness of each of the methods and then decide accordingly. Question number 6, side effects. What are the side effects to the contraceptive method that you may want to use? Now, I need to put this out there. There's absolutely no contraceptive method that is devoid of side effects. That's a given. They all have side effects. However, some may affect you differently. And one thing I should tell you, not because a method caused one thing with a person means that it's going to happen to you. Contraception is very unique. And that's why it's something that you have to discuss with your doctor. It's not wise to just look at other people's experience and say, oh, that happened to that person, so it's going to happen to me. No, everybody handles contraceptives differently. So you definitely need to pay attention to the more common side effects, though, of a particular method. For example, some come with spotting, some come with excessive bleeding, some come with weight gain. And these are things that are very critical for some people, depending on where you are in your health journey. So you need to pay keen attention to that. Then you have the next question. Question number 7. How do you feel about hormonal methods versus non-hormonal? Is your preference a hormonal method or a non-hormonal method? So as I mentioned earlier, hormonal methods could be like your pills or the injection. However, the non-hormonal methods, which don't involve hormones whatsoever, the condom, the copper T, it doesn't have any hormones in it. It only uses a chemical, a mineral rather, copper, which is wrapped around the little device. But it doesn't affect you when it comes on to the hormonal aspect. So that's another thing you need to consider. Which one do you think you would be more comfortable with? Question number 8. How do you feel about contraceptive devices? The devices tend to be invasive. They have to be placed inside the body. What do you feel about that? Is that something that's an absolute no-no, or is it something that you would consider? Because then that opens itself up to what choices you can make. If you are okay with a device, then you can use the copper T, the Mirena, or you can use the implant. Next question. Question number 9. How involved do you want to be in your contraceptive process, or to ensure that you are covered? So for example, the condom, you have to actually take that thing out and use it, put it on and use it as the sex happens. So sometimes it can be a little bit, interruptive, but some persons have learned how to make using a condom sexy. But then you also have the pill that you have to take every day. You have to remember to take it. And if you forget, and especially if you forget for several days, you can run into trouble, because then the level of the hormone is not at an acceptable level. So, there can be breakthrough bleeding, and you can also run the risk of getting pregnant. However, if you don't want to be involved in this thing, you just want to pop it in and, forget about it. Not forget about it, but not have to pay attention to it regularly. then you can look at more of the long-term methods. For example, the copper T and the implant, right? Because once those are inserted by the professional, you really don't have to do anything except to, they teach you how to check on it every now and then. And sometimes this is after you've had your period. You may check on the copper T, or you check to ensure that the implant is where it's supposed to be and it's staying there. But outside of that, you don't really have to get too involved. Question number 10. This is the last question for this session. How important is cost? Now, if you want your contraceptive to be free, I have good news for you. We have some absolutely free contraceptives that, thanks to the government of Jamaica, they are available at most of the health centers in the island. So I think once you start talking about a type 3 and over, you can get the injection free, you can get condoms, you can get the oral contraceptive pills free of cost. However, and you can also get the copper T inserted free of cost at the health center. The National Family Planning Board, I hear, has been working on getting the Jadel, that's the implant, or level plant, depending on which one will be used, available at health centers coming up. So, I mean, that's beautiful news, and all that will be absolutely free. $0. You'd have to take out the money. Who wouldn't want that, right? However, if money is not an issue and, your pocket's deep like that, then you have other options. For one, you have a wider choice when it comes on to the pills, because we don't offer, all the pills aren't offered at the health centers, right? So you can choose, pick, choose, and refuse any contraceptive pill that you want to take, and you pay for what you want and you move on. You can also pay for the Depo-Provera at the pharmacy if your doctor, you're going to get your doctor to inject you with it. There are also other methods that are available. You can also pay for the implant. Yeah. So if you don't want to go to the health center or the hospital to get it, your doctor, your OBGYN can insert it for you. No, these come with cost, because not only do you have to pay for the device, you have to pay for the procedure, and you have to pay for the visit. So that's something to consider. For example, I heard recently that to do the Mirena device itself can cost up to $35,000 Jamaican dollars. And then on top of that, you'd have to pay another fee to the doctor for actually inserting it, and then for the visit, that's another fee. So it can run you over $40,000, which, as I said, if your pocket deep, that's not a puppy money, that's a chump change. You don't have to worry. All right, but for everyone else, if you want free contraceptives, you can always check out the health centers and get them there. So there are many other questions that you could probably, ask and discuss with your doctor. But these are 10 critical questions that you really, really, really need to consider. And when you go to your doctor or your midwife, your nurse to discuss contraceptives, these are 10 questions that you definitely need to ask yourself and also discuss with your practitioner. Thank you so much. And please, if you're interested in this content, please don't forget to like and click that bell. So whenever we have more shows coming up, more sessions coming up, you will definitely be in the know and be able to watch. This is your girl, Marian, signing out for today. See you soon.